Remove the cover of the vial and wipe the rubber surface with an alcohol swab. Uncap the needle. Withdraw the same volume of air into the syringe as the volume of drug intended to be withdrawn from the vial, and insert into the vial with the bevel side up at a 45-degree angle. Once the rubber surface has been penetrated, then the syringe should be inserted into the vial straight on. This procedure prevents coring, which is cutting out part of the rubber stopper with the needle. The needle should penetrate the rubber closure but not go much further into the vial so that all medication can be withdrawn. Inject the sterile air in the syringe into the vial. This creates pressure inside the vial, forcing the liquid out. Keeping the needle in the vial, invert the vial and hold it with one hand to control the syringe. Pull back the plunger of the syringe to withdraw the liquid. Withdraw slightly more liquid than needed. Once the medication has been withdrawn,